This Lunch and Learn series will give you a step-by-step marketing cookbook from start to finish, an easy and cheap way to market your practice. Today we're going to talk about your marketing message. And many doctors their marketing message is more about what they're interested in than what their patients are interested in. We'll show you what we mean by that. I'm Dr. Paul Varnes. Feel free to contact me with any questions that you may have. My email is onearborvitae@comcast.net. My phone number is 773-519-0007. We're going to make some offers later. They'll be posted for free on Whole Health America Facebook page, which is facebook.com/Whole Health America. Also, if you want to see other webinars that we've produced, you can go to practicewebinar.com, and those are free as well. These 6 webinars will give you a step-by-step way to market your practice. This one is going to be about creating your marketing message. The second and third are going to be about internal marketing. And internal marketing is very important because most people think of marketing as attracting a complete stranger to come into your office. You put in an ad, you make an offer, and you get someone who knows absolutely nothing about you come in. That works in many cases, but it's also the most expensive way to market. Your own practice is usually the cheapest and most effective way to market. Then we're going to talk about social media for 2 weeks, and then we're going to show you dirt cheap and free external marketing. How to get those people into your office without spending a lot of money. Most chiropractors and other practitioners think of, if they want to get more income, the way to do that is to get more new patients. And that's true, but there are other ways to grow your practice and increase your income. Of course, new patients increase your income, but also you can be offering more services. You can get more referrals. Supplement sales are a great way to grow your income. And reactivation of old patients. So if you change your marketing focus, instead of getting new patients, I mean, you do want to get new patients, but on a market on a broader scope, you'll grow your income and your practice more quickly. When you create your marketing message or your ad, there are 4 things you need to be concerned about. One is it should be condition specific. Okay, don't advertise technique, don't advertise your qualifications, advertise for a specific condition. You also need a compelling headline and a subheadline. In general, there are exceptions to this. A headline shows the problem, the subheadline solves it. You want to always have a free offer and a call to action. Most docs, when they run an ad, do something like this. They'll put their name in the top. They'll have some kind of mundane slogan like "Your comfort is our concern." Nobody really cares about that. They'll put things about their qualifications. Palmer graduate. Your patients don't care. National board certified. They don't care about that. Patients don't care about you. They care about what you can do for them. Also, putting your qualifications isn't a real effective marketing means because people expect their doctors to be qualified. In this ad, there's a laundry list of complaints. Once again, it's hard to grab somebody's attention with a specific complaint. And here he's got an address and a phone number. This is not an effective ad. Unfortunately, this is what most people do. Before I go over this ad, I want to explain that this is one of our older ones. I was working with Ben Clark from Big Ben Media, and he was originally trying to market healthcare like you would widgets or anything else. And so there's some things in here that you might not want to say, okay? But it gets the idea across, so we'll go over it. Here's your headline: and lower back pain. Now, if you don't want to, that implies a guarantee. You might not like to do that, but you could actually just put lower back pain ? Okay, if someone with back pain sees that, you've got their attention. Okay, stop suffering. Relief from back pain is just a phone call away. Once again, he says he wanted to say specialist. He wanted to offer guarantees and all kinds of things. You might not want to say specialist, but you could just say, call Dr. No Hurts today for your free lower back pain report. Okay, you got a free offer. And with new patients, it's hard to get them through the door, but people will always sign up for free information. Okay, they'll get in touch with you, and you can build a list and a relationship with people who haven't come into your office yet, and then they eventually come into your office. It works better this way nowadays. Outbound marketing is the way marketing was always done. You put an ad, it will give you a free spinal exam, come in, and you expect the new patient to show up on on your doorstep. And that worked for a while. It's working less now, mainly because of the internet, because people shop around, they talk to their friends, they go on social media. And so now we're in a phase where something called inbound marketing is much more important, which inbound marketing is getting your name, getting information to potential patients, getting information about your practice is the way to market. It doesn't give you that immediate bang all the time, but this is what works. Here are some other examples. See, we got migraine headaches. You can get relief. Okay, specialist again. These are older ads, but I like them because they show things what we want to do. Free offer. Okay, these child's ADHD, the solution, free offer. Now a headline, like I said, there are exceptions to this. Here you got your free offer in the headline, and then someone will move on, and if they're interested in or think that chemicals are an issue, they'll call you for the free CD. Similarly, cold and flu season, they'll call for, they'll be curious about what those 10 foods are. So, it's another way to do it. Always when you do a message, you want to see how you want to track it as much as possible, see what kind of response you get. At Whole Health America, we set you up with free reports and materials to give away, and also a way to track, because people give their name and email address to get these things, and we'll show you how that works in a little bit. But that's one of the services we offer. So just to recap, when you create a marketing message, be direct and specific, have an eye-catching headline and subheadline. And your safest headlines are questions. You can put a condition with a question mark, and that's an effective headline. You don't have to be William Faulkner to write a good headline. And always have an offer. Always have a reason for them to contact the office, and have it free. People want to get free information. More and more people are trying to learn about their conditions out there. If you become a resource for them, when they finally do decide to do something about it, you're going to be the one they contact. I want to say a little bit about offers right now. You don't want to necessarily discount your services. I've seen nutritionists tend to do this a lot. They got a $150 fee, and they'll discount it to $75 for the first time, or something like that. That's not really effective. You want them to have a free something, okay? We at Whole Health America, we put a wellness quiz on websites and on your Facebook page. You can have people fill that out and come in for a free evaluation. And an evaluation is not your full new patient exam. It's a screening. It's a if you're advertising for back pain, for instance, you might do some orthopedic tests, and you might do some muscle testing or something very basic. And then at that point, you have a conversation with the patient. Yeah, I think I can help you. We need to schedule a full exam, or would you like to do a full exam now? So on and so forth. They want to find out as much as they can for free. Okay, that's just how it is. You can also do wellness webinars or workshops. At Whole Health America, we can provide you with the entire slide presentation for a number of conditions, and actually doing talks or webinars or workshops is a great way to get patients. Free reports. That's the easiest thing to do, especially when you are on Facebook or on the web. People are clicking around, and if they've got a condition like headache or backache or something like that, they'll download a free report to see if they can learn a little bit more. Information is the currency of the internet. And this is sequential, so you can have your message out there offering a free report. The free report can offer the evaluation or the health quiz, or you can go ahead and have your free report and offer a consultation right away, or you can offer a free consultation. Headaches, come in for a consultation. It's usually good to do it and add an extra step or two, so they can kind of explore you in your office and find out if you're the person that they want to see. And health reports are a great thing. There's a lot of people out there looking for information about their condition, and they'll download a report in a heartbeat. And one of the best ways to get your report out there is with a landing page. A landing page is a web page. You can put it on Facebook as well, where the person who comes there has can do one or two things. They can leave or they can opt in. Opt in, you collect a name and email address. Okay, so anybody who's gone to your web page and gotten the headache report, you can then email them and correspond to them about headaches. Okay, and interestingly enough, this is a simple headline, subheadline. Headaches, we can help. It can be that simple. Okay, if I've got headaches, I would be interested in this, and I want to find out. One of the things we do at Whole Health America is we put several of these landing pages on your website and on your Facebook page, so that you can actually, if you do an ad, if you do like a Google Click ad, or Facebook's a great one to do pay-per-click ads on, because you can target a specific zip code or demographic. You know, like if you've got something for PMS, you can make sure that only women see your ad on Facebook, and that's very valuable. And what you would do, a lot of people do ads and then they say, come to our website, and you go to the website and there's all this material on there. There's information about the doctor, and people say, oh, if I could just get them to my website. You know, that's why everyone loves SEO. I want SEO, but people go to the website, and do they follow through, and do they come and see you? Usually not. It's a lot like landing in New York City and wondering where the Museum of Modern Art is. It's much better to land right in front of the Museum of Modern Art. So if you're doing a headache promotion or a backache promotion, you want to take them to the page that has the offer, so that it's just that simple. They can go in there. Now, the other contact information, follow up for the evaluation and such, is contained in the report. Okay, this is a much more effective way than what most people do. Most people want them to go to the website and look around, and most websites are not compelling to patients. Here's another headache example: chronic headache, stop suffering. Okay, headline, subheadline, and offering a solution. Okay, which is your report. If you have a landing page, or what we do at Whole Health America, we put up websites that actually show the landing pages at the top in a flash presentation. So that when they land on the page, they'll see headaches, and then they'll see back pain, and they can click on those, and it'll take them to a landing page where they can opt in. It's an effective way. You want people, when they come to your website, to be able to take an action where you can get some information, get in touch with them. Here's an example that just goes straight to consultation, not bothering with reports, sinus problems, stop suffering. Come in for a consultation. We might be able to help you. Okay, this is also an effective way to do it. Here's an offer to take our free health risk assessment, and you can make that a computerized questionnaire. Whole Health America, we will put up a computerized questionnaire on your website and on your Facebook page. It's a very useful tool. The other thing I would suggest, wellness is one way to grow your practice is to increase your supplement sales. And 60% of all Americans take supplements. In a chiropractic office or other healthcare office, it's probably quite a bit higher than that. And the question is, do 60% of your patients get supplements from you? And if not, they should. And you can just put a simple sign or a message in your office saying, go to our Facebook page, go to our website, take the quiz, and come in, and we'll go over it with you. And have a wellness plan. If something as simple as a essential fatty acid and a multiple vitamin and a basic diet. At Whole Health America, we put these materials for you, and I'll show them. A great thing to have in your front office is something like this. What's your wellness score? Take our quiz and find out. We actually provide this poster to our customers. It's 11 by 17. We give it to you in a Word format, so you can put your doctor information, you put your contact information in here. So if you have other places besides your office to put it, you can use the poster. And they can be printed very cheaply at Office Depot, just for a couple of bucks. And this is a very valuable tool that will get people to your website, take your quiz, and so on. We provide the poster, we provide the quiz at Whole Health America, and we'll talk a little bit more about that. Another thing that's worth having if you are doing a wellness program, or if you're selling supplements at all, and I really recommend you have supplements in your office, even if you're not comfortable with nutrition, we can provide you with materials that can have you do very effective things for your patients without knowing a lot. Because 10% of what a nutritionist knows fix 90% of the problems. We have a diet that we have called the anti-inflammation diet. I had a nutritionist didn't want that on her website because she said, well, what do you need me for? Actually, I would dispute with that, because if she could get the information to her patients easily and cheaply, and then focus on selling the supplements, she could do a lot better. She was more interested in collecting a large fee for her advice. So if you're not into nutrition, we can provide you with a report that explains wellness care, explains a diet, and explains why they should be getting a good supplement. This report will be available on Whole Health America's Facebook page as well, so you can go there and download it. And once you have your message, we're going to give you a little peek into next week. You want to market first to people who currently and actively use your services. People who know and love you are more likely to help you grow your practice than complete strangers. Okay, and even if they don't need the particular service, they might know somebody who has. That's why you want to really treat patients right. You want to do as good a job as you can, and if you can't help them, refer them. Show them that they're a priority, and they will send their friends. I've had people that I sent to the hospital on the first visit because it was beyond me, actually send me patients over the years because they appreciated that. So second, you want to, your old patients, you want to contact old patients, especially if you have a new nutrition program or a detox program or something like that. Market third to people who've considered using your service but not yet acted on it. These are people you might have met at referral groups or at the club or Kiwanis, or people who know you and know what you do. That's your third group. And last, to strangers. And the last episode of this series, we're going to talk about marketing, to get new patients from out in the world, but doing it in a way that doesn't cost you a lot of money. Because if you're spending $300 or $400 on an ad, you have to see some kind of results on it. But there's ways you can get your marketing message out there on a very tight budget and still attract strangers. So we're harping away at marketing to current patients. Do your patients know all the services you have to offer? Do they know that you treat other conditions? Your back pain patient might not know that you have a solution for sinus or allergies. And if they learn that, they have friends that do that. Like they might just think of you as a back pain doctor or a headache or whatever it is that you treated. Okay. So it's important that you keep contact with your current patients. We're going to go into this in great detail next time. And one of the best things you can do in your office is to add a wellness program, because that's a way of getting your supplement sales up. And for what it's worth, it does help the patients, because if you give them, we have this anti-inflammatory diet report that you can give them. We also have it set up. There's a free report that we'll give you. I'm going to show you that in a minute here. This is our Marketing Wellness ebook. This is available at Whole Health America's Facebook page, which is facebook.com/Whole Health America. You can download it for free, and actually it will give you an overview of a marketing system that will work. It's about wellness, but you could easily plug in detoxification, headaches, sinusitis. The pattern that you follow for this works very well. And on the copy we're offering, it shows you how to answer the issues that come up in the questionnaire, and gives you treatment options. It's a really valuable tool for someone who does not yet do a lot of nutrition. Someone who knows a lot of nutrition can take our questionnaire and come up with a treatment plan, no problem. But this is all the information, soup to nuts. It's on facebook.com/Whole Health America. So you just, for a wellness program, give them a handout that explains diet and gives meal ideas. If you don't want to get too involved with it, it's nice to personalize it. But if you give them a diet high in fruits and vegetables and with no starches or sugars or trans fats, people are going to do better. Add a multiple vitamin and an essential fatty acid; they'll do even better yet. You can base a third test. Once again, we give you this questionnaire, and you can come up with a third supplement. And right there, you can take an existing patient that's spending another $50 or $60 a month in your office. You do that 100 times, you've increased your income significantly. And with something as simple as a sign in your waiting room, and even if you just scrawl it on a whiteboard or print something on the computer, take our wellness test and come in for an exam, people will respond to that. At Whole Health America, we're working at getting a collection of these. We've got stress, we've got detoxification, and we've got wellness so far for posters in the office or posters that you could take elsewhere in the world. It's also valuable to have a newsletter. A newsletter you can make available to your patients in the office. Always, always, always have your offer, your marketing message somewhere on that newsletter. It's like you bought advertising in your own newsletter. And as that gets out there, people will keep the newsletter, and then they'll see the offer. It's much more effective. Like a lot of people use brochures, spend a lot of money on brochures. They don't get read, they get thrown away. People will keep newsletters and read them. And at Whole Health America, we give you a condition-specific newsletter every month. So to recap, you want to market to a single condition with a headline, subheadline, make a free offer, and a call to action. Make sure your current patient base gets the message, and get your message out to the public dirt cheap or free. And we'll go into this. There's very inexpensive ways to get people to get your marketing message if you are trying to attract new patients. There are referral groups, co-oping, which is getting a business that's in a similar business but not competing with you to have your marketing information on hand for their customers. In return, you do the same for them. Facebook is like a referral network on steroids, and we're going to spend a lot of time showing you how to use Facebook to grow your practice. Signs and bulletin boards. These are all free ways of getting your message out there. And Whole Health America, as I've implied, has a lot of tools that help you with this. Now, can you do this without us? Sure. We just try to make it easier. It's a lot of docs don't have time to be writing reports. We do it for you, make it look like it came from you. And we set up your whole internet system to do this type of marketing, and we do it very inexpensively. We give you a search-optimized website with several landing pages on them. So if you do any ads, or you can actually attract people to the landing pages. The home page has links to the landing pages. So the first thing a patient sees when they go on your website is the connection to the landing pages to address the health problems that they're interested in. This is a very valuable tool. We also put these landing pages on Facebook for you. And what's really nice about that is you can take the link to your landing page, post it on your Facebook page, and all your Facebook fans will see that this is an offer that's available to them. It's a very powerful tool. And we do customize your Facebook page. We can actually put your all the information on your website on your Facebook page. We also give you free articles, hundreds of health articles that actually, with the click of a mouse, you can have it posted on Facebook. You can also email, like when you have email to your people that say have gotten headache, you can actually email links to the articles on headaches on your website. We'll put the articles up for you. The thing we do with Facebook is we put these custom tabs on there. When we say the landing pages, we can also put other things. Some people like a lot of landing pages. Some people like the idea that someone can make an appointment, contact, the health articles we put in there, and then stuff from their website about the practice and their services and so on. It depends on what you want. Like I say, most people like to have the landing pages because that's the most powerful marketing tool. And then the way to get the information that, like the services and the practice, is we put links on every tab so that they can go directly to the website. We put a health quiz up for you. Patient can take the health quiz. It tells them obliquely about where the source of their problems might be and encourages them to come in for a consultation. Once again, very powerful tool. The reports that we give we'll often tell them to come to the Facebook page or the website and take the health quiz. So what you're doing, people are out on the internet looking for information. You're providing that information. You're creating curiosity about your practice, and eventually turns into patients. We give you a custom newsletter tool. We give you the newsletters. We also have a tool that you can paste the newsletter or any PDF file and put it up on the internet as a web page and send that link out, so you can send your newsletter out as a PDF link. You can also, any other PDF file you have, any ads or any kind of promotional material, you can send to your patient base with a click of a mouse. And as we grow, we produce more and more marketing material. Like we say, we've got the posters, we've got ads, we've got our webinars. So we make this available to our customers, and we do it for you. So like you can come up with a poster that, asks people to take your quiz and wellness score, but over time we're going to get more of these, and you can have something with nice graphics like this and put it right in your office. And since you're putting up with this webinar, we've actually made this much more inexpensive for you. We'll show you. Okay, we'll give you a website. We'll give you we'll manage your Facebook page, and we'll even post for you twice a week, because some people get too busy to post on Facebook and their fan base dies out. We put a couple of posts up just to keep things going. We get the newsletter, our marketing tools, and the website for less than most people are paying for their website. Okay, this is $67. It's normally $99 a month. Because of the webinar, we're dropping it to $67. If you go to wholehealthus.com and sign up, write the word webinar, and the price will go from $99 to $67. Also, we'll waive the $1,500 setup fee because, face it, we're building a website. Okay, go see how much it costs to build a website. We're going to do it for you. Or price a managed Facebook page. Tell them you want 8 tabs on your Facebook page and you want to put up. You're going to pay $1,500, $2,000 for either of those. Okay, we're including it in the monthly price. So if you're interested in this, go to wholehealthus.com/wholehealthpro and write webinar and sign up, and we'll get you started. If you have any questions, you can contact me at Paul Varnes at 1arborvitae@comcast.net. My phone number is 773-519-0007. And go to our Facebook page, facebook.com/wholehealthamerica. There's a lot of free stuff there. You can get that free marketing book, Marketing Wellness book. I really recommend it. It'll really help you as you go through this series. And also our free webinars are on practicewebinar.com. Oh, here's more contact information. Like I say, you got the phone number, 519-0007, 773 area code. You can also mail at wholehealthus.com, and we'll get back with you. You find us on Facebook. We also have a LinkedIn account. I'm not great. And we also on YouTube under my name, Paul Varnes. There's a number of tutorial videos and marketing videos there. Feel free to use it. I look forward to hearing you. I hope you found this valuable.